Hi, everybody. This is Stephanie Stock, the president of Ohio Advocates for Medical Freedom. Today, we're talking with mom, Janine Deal. She has a 12-year-old little girl named Adaline. She has been denied being put on the heart transplant list at Cincinnati Children's. Yet again, Ohio leading the way in vaccine status discrimination for children, just like they did with the Donaldsons in Cleveland Clinic. So, Janine, why don't you tell us a little bit about Adaline, your family, how this happened, when you found out that you in fact were not going to be allowed to be put on the list, and what reason the hospital gave you.
Sure. So we adopted Adaline, and we knew when we adopted her that she had a sick heart, and we knew eventually, one day we were probably going to need a heart transplant. But she has had several procedures, and she's done really well with them. But now we're to the point where the last couple months she has declined, and through all the testing they've done, they realize she's going to need to be have a heart transplant. So they were just talking with us. The doctors at Cincinnati Children's were talking with us and told us that one of the requirements is that to be put on the list is to have the COVID vaccination and the flu vaccination. And that is against everything we believe in. We asked for a religious exempt, and they said no. And they said, this is our policy, and this is what we stick to, and they are not going to change their minds. So this is kind of what.
And what was the reason what was the policy they said they were basing this on? Like, where did this come from?
This comes from the NIH.
Okay, so NIH recommendations, which are just simply recommendations, and they've decided to adopt that and make that policy. So, and this is something that has come up before. OAMF started in 2015. We've been fighting for vaccine choice legislation for all of these years. And even though we have a Republican majority, we haven't been able to get a bill passed yet. And we keep having horribly tragic stories like yours, like the Donaldsons, like Mike Yohop, just people that have been vaccine injured or have been denied services. This has been going on, and this has been going on with healthcare workers since really 2012, because the flu shot was made mandatory for healthcare workers. This has been an ongoing problem. It's been ignored. COVID really brought all of this to light. I think that's when people really started to realize, man, this vaccine status discrimination thing is a real problem. Those medical freedom groups that were talking about this before, like, they were onto something, So we've had a lot of people, unfortunately, come to the realization that this has to be handled. And it's not going to be handled one lawsuit at a time, saving one kid. It's going to be handled when legislatures like Ohio, who is now a Republican supermajority, takes the lead and says, we're not going to tolerate this more. We're going to protect our citizens. We're going to protect our children, especially that are suffering medical discrimination, which is what this is. I mean, I can't think of anything more horrible than denying a child a heart transplant or a kidney because of their vaccination status. And with everything we know about the harm that can come to that, and also people's strongly held religious convictions against doing things to alter their immune system, the fact that that hasn't been protected has been tragic. So, I mean, I'm sorry you're here. I wish that we could have gotten a bill passed. It's not for lack of trying, unfortunately. It's not our fault. So, that's one of the reasons we wanted to have you on, is because the legislature needs to act. We have got to get bills passed for protection. Now, interestingly enough, during our conversations, we had the realization that your daughter-in-law is the sister of Vice President J.D. Vance.
Yes.
I was shocked. I mean, not really, because honestly, at some point, everyone's affected, right? Even at the highest level of government, there isn't somebody that doesn't know somebody that suffered an injury or suffered some form of discrimination. So it would be silly to think that we couldn't have this happen to an extended family member of somebody even at the highest form of government. So I'm sure that once this gets out, it's definitely going to get some media attention. Do you feel like maybe this will be enough to get our Republican legislature to act?
I'm praying it is. Something needs to be done.
Yeah, we agree. And I just I'm so appreciative that you are, you're fighting so hard for your daughter against all odds, right? I mean, these hospitals truly are bullies. I mean, the things they not only when you're in your situation, but we have parents that have been contacting us for years that, we're going to kick you out of our practice if you don't take these certain shots we want you to get today. I mean, it's a terrible way to provide health care. I mean, it's been horrific what we've seen from the parents. So, if there was something that you would like to say to the Republicans in Columbus, and I know you are yourself actually in Indiana, you guys have come over the border, and
Yeah.
this kind of legislation is needed in every state, but in this case, legislation here would protect Adaline. So, I mean, is there anything you would want to say to our Republicans here? Any kind of plea to them on as far as getting protections passed for individuals for vaccine status discrimination, and protecting conscientious objections for parents who need to get care for their children?
I say it's time to step up. It's time for them to pass this bill and protect everyone. This is crazy that we're still going through this, and it's time to do it. Let's get it done.
Yeah, I agree. I mean, if this should be expedited, this should be done. This should have been done. It is 2025. There is zero excuse for any parent to be in your situation right now in Ohio or in any state. So, today we'd like to put out a call to action specifically, and we're going to give everybody the information they need to participate. We are going to put a call to action out on the senior executives at Cincinnati Children's Hospital. Adaline needs to be on a heart transplant list today. This is absurd. This is a complete violation of religious and conscientious freedoms, which is what our country is founded upon. And we need a call on Ohio Republicans in the House to co-sponsor the new version of HB 319, which we have included a provision that specifically protects children like Adaline, children like Tanner Donaldson, that they cannot have discrimination based on their vaccination status that their parents have chosen for them based on conscientious religious objection. So we're going to give everybody the information that they need for that. And we just hope everybody's going to participate. Our goal is to get Adaline what she needs and to get the state of Ohio, the individuals and the children protection permanently so that we don't have to keep doing this, because I am frankly tired of bringing stories to people. Another tragic story. There should not be one more tragic story. The Ohio legislature could end it immediately if they wanted to. And so we hope they will act. So anyway, I want to thank you so much for what you're fighting for. And I know you're busy. You got your stuff. You got all those kids. You're adoptive mom. You're amazing. God bless you for adopting all those sweet babies and giving them a wonderful home. It reminds me that in 2019, we actually fought to protect the ability for foster parents and adoptive parents to be able to take children in without having it forced on them to vaccinate themselves and their family to be able to adopt. And that was it. No, that kind of flew under the radar. Not really. There weren't really too many people other than our movement, because this was before COVID, right? So we weren't the cool kids in town then. So nobody really knew, but we saw that. We're like thinking to ourselves, like, think of all the wonderful Christian families, and a lot of conservatives who, they object for conscientious reasons, and they weren't going to be able to foster or adopt children. That was horrifying. So it was an act of God that we even got the information that they were going to be voting on that. We put up a quick call to action. We had like 2 days to do it. We got like 200 people to write in. They'd never had that many people, because ODJFS said, like, that's like nobody pays attention, So we got that. We got those exemptions saved. So we really care. Adoptive families are really important. And so I know this is a segue, but so just thank you for that, because it's wonderful. It's wonderful what you guys are doing. And we're going to pray for Adaline, but we're also going to fight for her. We're going to fight for her.
Thank you. Thank you.
So, all right. So everybody can find OAMF at ohioamf.org. Please sign up for calls to action. We're going to tell you what you need to do for both the new version of HB 319 that's going to be coming out, and HB 12, which is another one which is our drug access bill and our medical free speech bill that was just dropped recently. So that's HB 12. So we'll be guiding you through on the process on what you need to do for both of those pieces of legislation, and who you need to call for reaching out to Cincinnati Children's Hospital. Please consider donating if you can, because we are really focusing this assembly on targeting the legislators that are standing in the way of passing these bills. So whether we need to primary you, text message your district and let them know, what bills you're blocking, that's what we're going to do. So anybody that donates, know that your money is going to be used to hold your legislator accountable. So thank you again, Janine, for being with us. Keep up the fight. We're going to stay in close contact with you so that we know what's going on with Adaline, and we'll be with you every step of the way. So thank you.